Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery, and I've been practicing cosmetic or aesthetic plastic surgery in the Scottsdale Paradise Valley area since 1992, and that is all I do. All I do is cosmetic surgery. A large proportion of what I do is facial rejuvenation and facelifts, if not brow lifts and eyelid surgery. And one of the common questions that I get from patients is that I've had a facelift several years ago. Can I get another one if I see aging? And the answer to the question is yes. The question also implies, well, when is the right time to have another facelift? And it really depends upon presentation, and that's what getting to know a plastic surgeon and having a relationship with one that you develop a trusting communication is very important. Facelifts in the past relied upon skin tension to perform the facelift, and that's caused a lot of distortion of the earlobes and hairline shifts and whatnot. And that's not how I perform a facelift. And more contemporary techniques really depend upon deep tissue elevation, the layers that have the muscle and fat, that's called the SMAS layer, to elevate the tissues back into a more youthful position, and it kind of drags the skin with it, so there's no tension on the skin at all. So when somebody has had a facelift in the past, it really depends upon the time when things really start to change where it visually bothers you. If someone has some subtle changes, there are some non-invasive techniques that can perform very, very nice results with regards to lifting the neck and also the mid-face area. Something like Ulthera, which is a non-invasive therapy that helps tighten the skin and muscle. There's also something called Thermi, which is radio frequency that tightens the neck. But more importantly, I think it's important to develop a post-operative regimen after your first facelift to maintain the results. So I think it's important to get on a skincare regimen. I think it's important to continue with Botox and fillers, should you like. But when it comes time to have the facelift again, I think it's very important that you choose a plastic surgeon that does the techniques that still do not pull the skin so there's no distortion. Again, if there's a question about when is the right time to have that secondary facelift, I think it really just depends upon presentation, and I think the best thing you should do is go see your plastic surgeon and get an idea if you are ready for that secondary facelift.